Hello, and thank you for contacting Wave Support. I see from your clinical request that your patient is struggling with some late-day blurriness that seems to be not as much of a problem earlier in the day. Well, just a couple general comments. If we look at your topographies, um, it looks as though you've got a bit of a ridge here in both the right and the left, that little red ridge. I suspect that is probably some warpage from their prior contact lenses. If I'm correct with that, one thought that I try to do on a lot of these patients, especially if you're refitting them, I generally try to have them stay out of their gas permeable lenses for at least a few days to try to let that cornea relax so you get a little bit more of a true cornea. Otherwise, you end up with a cornea that has a design that's a very accurately designed lens for an inaccurate cornea, which sometimes will create some issues. In this particular case, I would suspect that these lenses, the prior lenses, tended to sit low on the eye, and part of the problem, they probably got away with it because they were monovision, so they were probably staying within the optical zone. My guess is that your current lenses are probably fitting very nicely, but they probably later in the day will, in the first thing in the morning, they probably center very nicely. Later in the day, they probably drift a little bit lower to follow this other contour just from the weight of the lenses, and therefore you're probably getting some more of the blurred vision. And that might even create some little adherence and some drying, which can also contribute to that. Now, as you know, it's not very practical for most cases for these patients to stay out of these lenses, especially in the higher powers, so I realize it's not always feasible in the clinic. But sometimes what I'll do, if that's a possibility to do that for a patient, I'll have them stay out of their lenses maybe over the weekend, Friday, Saturday, Sunday, come in first thing morning on their way to work, get fresh, clean topography, and just double check the endpoint of the refraction, and then they can wear their lenses as I'm working on their designs. So with that said, let's just talk about your designs for a second. One thought, I'm looking at your right lens here. One thing you could try to do, if this is the topography that you have to work with, what I would try to do is get this topography to the back surface of the contact lens, which is the lower left view in your quad views, to more closely mimic the surface of that cornea. And I see you chose the G-SIM. In these cases where it's almost a little asymmetric there in the design, irregular, you almost have to go to freeform to try to get that back surface of the lens to more closely match the topography that Wave is seeing. And that'll give this lens a little bit better chance of just fitting over that little funny ridge more like a glove. So in these cases, what I'll tend to do is click on freeform, and then sometimes I'll even throw in a little back surface asphericity, just like a 0.05 using that S-Factor tool. And then if you click on current settings, let Wave redesign that lens. In just a moment, you'll see that you got a back surface of this contact lens in the lower left view that almost perfectly matches the front surface of the cornea. So now I believe you're going to have a lens that's probably going to have a tendency to more stay consistently centered on the eye. Of course, some of these lenses fit kind of snug, so you have to make sure you leave enough of that peripheral curve edge lift to create a tear pump. And what I often do too, just to sort of see, especially if this patient has worn gas perms in the past, quite often I'll switch over to just click on the RSIM box and look at my base curve on the left. That'll kind of give you sort of the spherical base curve equivalent, just to see how much different it was from their prior gas perm lens, just to see if we're sort of in the ballpark. Just some helpful information that I use. Certainly if the lenses seem a little too snug on the person, you could redesign this lens using axial design. And sometimes I'll do that, especially if I feel the lenses are adhering a little bit later in the day. I'll just switch over to tangential from the axial. Tangential will tend to be a little looser as the day goes. But with that said, I would really work on getting that back surface to match. Same thing, a left eye. The other thought you can try also, if you suspect you're getting a little bit outside that central zone, on the left lens, I believe this patient was previously wearing a left near lens in their monovision. What you could do on the left side is just switch over to a near center lens, and that way you give sort of a modified monovision, almost like the ProClear multifocal approach, where you've got the one eye distance center and the other eye distance near in the center. So just a couple thoughts there. And if you look at this left one, we'll do the same thing there. If I just kind of click on freeform, before I do that, you'll see this lower left, you have kind of a nice bow tie look, but it's a lot different than what you have in the cornea. Here's this lens, in this case, may have a tendency to want to push this left lens downward and temporally, a little bit out, a little bit off center, so you may be losing that visual axis, especially if you have a little tight distance optical zone, you might be losing that optical zone, giving you some more of the blurriness. So I would go to freeform, throw in a little bit back surface asphericity, let it design itself, and you'll see once again you get a lens that looks very, very similar to the topography. With that said, I think those little subtle adjustments will help you get reacclimated. If all else fails, you may find yourself even going back to more of a monovision effect. I found that even though multifocal sounds like a great idea, some of these monovision patients, as you know from some of your prior clinical experiences, some of the monovision patients just seem to really enjoy that. So use your best clinical judgment, but I hope these little fitting tips will get you back on track. With that said, I wish you well in this case, and thank you for contacting Wave Support. Have a great day.